Daryl, nobody, or nobody from the public?
I would still recommend opening the public comment period and then closing it.
Yeah, but Kelsey said nobody was on the list.
Kelsey said nobody. Okay. All right. Well, we have the public comment period. We have no one for the public comment period. So we've opened it. We will now close it because we have no public commenting. First item then is monthly board education sessions, updated immunization fee schedule. Is Jason on? Yep, I see.
Hi. Okay, so you want me to just go ahead?
Yes.
Okay. All right, so we had received notice from Pfizer that Prevnar 13 and Trumenba are going to go up in cost. So the current price right now for each one, the Prevnar is $229. That's what we charge, and it would increase to $240. And the Trumenba would be $163 and go to $182. And also, there's a newer vaccine, Prevnar 20, and we can offer that one after the first of the year, and it would be $262.
Jason, you want to briefly, can you briefly describe what goes into determining how we determine these prices?
Yeah, so it's of course the cost of vaccine, and then we add in the cost to store it. So the electricity usage for the freezers and refrigerators, the Helmer units, and staffing, handling, not the actual nursing staff, but ordering of the vaccine, inventory, stuff like that goes into it, and it comes out to $14.03, and we round. So that's the difference between the cost and then what we charge.
So I'd like to point out that this is the price we charge insurers if we're billing insurance. That yes, does not impact if you're worried about people who are uninsured or are Medicaid patients or whatever. They still have access to the vaccine for children, the VFC program. We just recently had that review, by the way, and it went very well. But so if that's a concern, that's who this gets billed to, is insurance payers.
Correct.
Okay. So after the first of the year, will you only use the Prevnar 20 and stop using the 13, or do you continue having both of those available?
My understanding, and I could be wrong on this, but my understanding is that we would have both. So the way I understand it is the 20, I believe, is expanded.
Correct.
Yeah.
So how do you determine who gets which one?
So Mike, again, the Prevnar 20. So we had this period of time where we kind of went through. People got a sequence of pneumococcal vaccine. Dr. Gates was always trying to remember which one goes first and how long do you have to spread them out and that kind of thing. My understanding is what will happen is, rather than an adult getting a 13 and then the other one, or vice versa, that they will simply receive a Prevnar 20 when it's appropriate. So it's a way to move away from those two pneumococcal vaccines and into a single vaccine.
Okay, that's what I was asking.
There may be some people who need the 13 to complete a series, but my guess is that's where we're headed. Dr. Gates may actually know more about that than I do.
Yeah, with the introduction of these two vaccines, it's always been a little bit complicated trying to follow this, but I agree with Dr. Purdham's statements that of the 20 likely is going to be the one that would be utilized going forward.
Okay, so if someone has had 13, then would you recommend them to get the 20 if they came in and asked for it, or
What
that not be
I
appropriate?
would recommend that you talk with one of the infectious disease doctors to get the latest information. Probably what the information I haven't looked at it for probably over a year. Whatever I have is probably a little bit behind right now, right off the top of my head.
Okay. Any questions for Jason?
So just to clarify, we kind of went to we had a Prevnar 23, Prevnar 13. People would get one, and then a year later get the other, and so that's. I'm just looking here to see what the CDC is saying about that, and then they said, well, we're not going to routinely recommend the Prevnar 13. There's some special cases where it still might apply. So I can see why we would keep it around, but the 20 is probably going to become the default vaccine.
I have a question, just a general question. So if you've already had a pneumococcal shot previously, do you get another one, or is that good for life?
So if you receive your pneumococcal vaccine after the age of 65, you just do it one time.
Okay, I had mine when I was 50.
Yeah. So when you turn 65, like a lot of other wonderful things that happen to you when you turn 65, you you will qualify for a pneumococcal booster.
Oh, woo-hoo.
I know, and then
So
you'll
get
get set
the
for
20.
life.
Get the 20 because it's got more in it.
Okay.
And
Thank you.
And then the other issue is we also look at the individuals. So if a patient has had a splenectomy, for instance,
Right.
then there's a whole nother set of rules that go on because the duration of the vaccine is likely to last for less time. So again, we'd like it to be simple and straightforward, but there's a lot of caveats that go into this.
Okay, thank you.
All right, thank you. Any other questions then for Jason? Jason, thank you. We'll be voting on that a little bit later.
Thank you.
Next
You don't
item.
have to stick around if you don't want to, Jason, but you're welcome to.
All right. Thank you.
The next item is update on the school guidance. And is Ashley? Yep, she's with us.
Hello, everyone.
Hi, Ashley.
Hi. So here we are again, chatting about school guidance. So we have pushed through, it seems like a fairly minimal edit to that guidance. It could have some larger impact. So I was just going to kind of give you an overview, but not necessarily go through the guidance itself. So the guidance that we currently have available basically tells schools black and white contact trace. What we have went through and suggested for updates is to continue on with the guidance of asking schools to contact trace, but update it to say to the best of your ability or as capacity allows. So we are hearing quite a bit from schools that it is just, it's straining their system and they're not able to keep up with it the way that they had been working through contact tracing. And so we are wanting to update the guidance to be a little bit more consistent with what DESE has written into their guidance, which is just a little bit more flexible to work with the health departments on contact tracing, or to, you know, if there's certain scenarios that schools are going to contact trace and other scenarios where the health department is going to contact trace, just work it out and not have it just be as black and white. So we've updated that guidance and sent you all a draft review. And so if there's any questions, I'd be happy to answer those.
Dr. Gates, I know you have something. Would you like to?
Yeah, while I was reviewing the document again, from what I understand is many of the school districts are going to, or have already voted to discontinue the mask mandate, most of them effective at the beginning of the new year. And so this document, I want it to be clear about what is considered an exposure. And so the page that has the contact tracing capacity update December 2021, you can go to that page. It's about halfway through, maybe not quite halfway.
There, I've put it up on the screen. It's on page 12, Dr. Gates. You should be able to see it now.
Yeah, the point, the document, basically, without that paragraph there, is saying that if two people were in a room and they were close enough proximity for long enough period of time, that there would be deemed an exposure. That if one of them was wearing a mask, either the one that had COVID or the one that did not, then the one of the persons would not need to quarantine because a mask was in play. And that first paragraph is just, the way it's worded is, in the bullet point at the top, it says, it is important to note that if either the person with COVID-19 or the person exposed to the positive case was not following the school's mask policies or was not wearing their mask appropriately during the time of the exposure, the close contact should follow standard quarantine protocols and quarantine at home. So that is kind of in contradiction to further down in the document. Gary, can you read off that? Ashley, you know where I'm talking, right?
Yeah, the update on contact tracing capacity.
Yes.
Yeah.
So my thought was to remove that paragraph because it kind of blurs things a little bit. Because I'm reading that, it looks like both people would need to be quarantining if they weren't both wearing a mask.
So Ashley and I, oh, go ahead, Ashley.
Well, yeah, so that is actually the guidance. That's DESE and CDC guidance, that if both parties are not masked, that they would be considered an exposure or a close contact. That is essentially just reinforcing and, hey, a reminder that if both parties aren't masked, that the individual who was within 3 to 6 feet of that positive case would have to quarantine. Even if the person who had COVID-19 had a mask on, but the person who was exposed didn't, that person would have to quarantine, and even other way around. So it may be confusing. We might be able to clarify. I'm not sure if the goal is to just clarify, or if your question is really around the definition of close contact in and of itself.
Yeah, Gary, you had read something off somewhere else within the document that pointed a little bit different direction. Do you remember where that was?
No, I apologize.
Okay, hold on.
So
Well-
I agree with, when you read that and you say, if the positive case was not following the school's mask policy, if the mask policy is mask or voluntary or whatever, and somebody says, they didn't say I had to wear a mask, I was following the policy, I think we almost end up just leaving the school policy out of it and saying, if the kid's wearing a mask, they're in. If they're out, if they weren't wearing a mask, they're out. I mean, because the school policies are going to be all over the place in our county for sure.
Right.
And so Ashley and I talked, and if it will clarify the document, we agreed it would be okay to remove that bullet point. And I know I had that conversation with Dr. Gates, and he was comfortable with that, but obviously he can speak for himself.
Yeah, I'm okay with that.
Yeah, that I think is probably the simplest solution.
The paragraph following that bullet point says, if the school has not implemented universal masking, close contacts in the school setting should follow previously implemented quarantine protocols and quarantine at home per current quarantine protocols also, which I don't know why the also is in there. But I don't know if that clarifies that or would give them enough clarification to know what to do.
Well, I would recommend just removing the bullet point for clarity's sake.
Yeah, that sounds good to me as well. That's-
I make a motion to remove that bullet point.
Well, we'll do that under new business.
Yes, under new business. Okay. That was,
When we approve that or vote on that, Dr. Gates, if you'll make that motion with the change, then that'll get that in there.
okay. Thank you.
Is there anything else in the document? Were you okay with the rest of the document?
Yeah, I think I think a lot of this really affects the school's ability to do the contact tracing. And I was interested in Kathy's thoughts on this.
Well, Dr. Gates, I, as far as looking at the document, I appreciate the ability to have on schools, for schools, just have those guidelines as additional highlighted things, that we do that to the best of our ability. I'm not sure I know of any district in the county that has an ability to sustain the contact tracing and the at the rate that is occurring right now. It's just absolutely exhausting. It's working 2 jobs over almost 2 years, and it's just I don't know of any district that's really in that boat that has the ability. So adding that language is greatly appreciated, and that will give school districts the leeway to be able to, like I saw in the Tribune, I think one of the school districts a little north of here, able to already implement things coming back in January. But I feel like what I've heard, they will mostly all be about the same. All of our schools in the county will be pretty much very close to doing the same thing, is what I think. But anyway, just greatly appreciate the work in that understanding and being able to put in some of that wording. It's very helpful.
All right. Did anyone else have any other comments on the document?
Well, hey, can I just make one other comment too that's really interesting too, is that just for speaking at the place I'm employed at, so in our school district, we were able to run data, and I know, Ashley, I shared this with you, and I can't remember the exact percentage, if it was 1.4 or 1.9. But the other thing we've noticed with the close contacts, just for you all, the rest of the board to know, of all the close contacts, we've sent home hundreds of close contacts, and that's one of the parents' most angering points at the moment. And I mean, it's just getting more and more volatile, honestly. The people probably coming at you guys and us as well, but of all of the close contacts we've sent home, our in-school transmission rate is like 1.4%. It's not huge. So, you know, just sharing that so you guys kind of know the current reality of the, you know, some of these measures work really well, and just so thankful that, you know, we've just, and I don't know if all districts are like that. I can't speak for that, but the one I'm employed for is just, you know, that's a really low number. And hopefully someday something will be published to show that, you know, the only businesses that are being asked to uphold this like rigorous tracing, rigorous quarantine, nobody else is doing this. So to hold schools to that continually for the long haul is just not sustainable, really. And you know, I'm thankful our in school transmission rates have been so very, very low. When we quarantine folks, they just don't trip positive. And many of our parents are so frustrated because these kids are quarantined multiple times. We're not talking about just once. We're talking about I mean, we have some kids, they've missed 40 days of school, for crying out. You know, they've missed so much, and they've never turned positive, you know, so that we've got some data, longitudinal data to show that what's in this recommendation, the new highlighted portions, to give a little bit of since, you know, just consideration. So thank you. Thanks, Ashley, and your team, and all you guys at Clay County too, and the staff.
Sure, thank you.
All right, any other questions for Ashley? If not, Courtney, we'll go to the treasurer's report.
Ashley, you can stay, or you're welcome to leave too. So.
Okay, so everybody got the financial statements with your board packets. Does anybody have any questions?
Everybody just disappeared off my computer.
Uh-oh.
I still have the meeting.
We can still see you.
See you.
Huh, I can't see anybody.
That's weird.
All right, well.
Okay. I wonder if you hit like a camera setting or something so that it. If
We're
you click
too ugly for Florida. That's the problem.
Yeah.
Yes.
Click on the 3 dots and then see if turn off incoming video is chosen.
I don't have 3 dots.
Oh.
All I have is KM, whoever KM is.
Oh, I know.
Right at the bottom of your screen by the microphone, you see the microphone and the camera?
Yep.
Okay, to the right of that is a speaker symbol, and then to the right of that are 3 dots. Do you see those?
Nope, wait a minute though, let me see if.
Camera, microphone, speaker, 3 dots.
Camera, microphone. I have no 3 dots, sorry.
Nothing to the right of that? Huh.
Sorry.
Okay, so everybody had time to review the financial statements that were in your packet. Does anybody have any questions over those statements? I do have some notes for you to keep in mind. The revenue for November was $298,064. Year to date, the revenue is $7,786,665. We have received approximately 86% of our budgeted revenue. Expenses for November were $583,483. Year-to-date expenses are $8,241,705. We have spent approximately 91% of budgeted expenses. The COVID-related expenses have caused medical waste, professional and contracted service, janitorial, and rent expenses to be higher than budget. Okay, do you have any questions over the financial statements? Okay, I'll go on to the schedule of investments. And so we have 6 that are maturing this month, and there will be 2 that will be maturing next month. And you can see highlighted in green the ones that have been purchased this month. Any questions there? Hearing none.
All right, thank you, Courtney.
Thank you.
If there's no questions for Courtney, then I need a motion to accept the November 2021 financial statement as presented.
So moved.
Second.
All right, I have a motion and a second. Any questions, any discussion?
Not about the financials. I apologize. We now have a new person doing the minutes. Kara, I forgot to introduce you at the beginning. Sorry. So Kara was going to be doing the minutes for the board going forward. So this is her first meeting, and I know she's a little nervous, but she's going to be fine. But if you wouldn't mind, Pat, just in the first couple of meetings, mentioning the name of the person that first and second for her until she gets accustomed to everybody's face and voice.
Well, or as you make your motions and second, say who you are so that she'll have that also. And you'll have to go back. I don't know who made the motion.
I did, Kathy.
Kathy did. Okay. And second,
Second, Dr. Gates.
Dr. Gates. Okay. Any
Thank-
discussion or questions? All those in favor?
Aye.
Opposed? All right, now I need a motion to accept the November 2021 schedule of events as presented.
Courtney will make that motion.
You can't. You can't.
Sorry.
I thought we were on to the consent agenda.
No,
I'll make the motion.
we're on the schedule of investments.
Okay, sorry.
No,
Yeah, I
that's all
get
right.
excited.
This is Dr. Purdom. I move that we accept the schedule of investments as presented.
And this is Kathy. I'll second.
Any questions or discussion? All those in favor?
Aye.
Aye.
Opposed? All right. Courtney, now I need a motion to accept the consent agenda as presented.
So moved by Courtney.
Second by Dr. Purdom.
All right, all those in favor?
Aye.
Opposed? All right, new business. The first thing is to vote on the approved updated immunization fee schedule. So I need a motion to approve the updated immunization fee schedule.
So moved.
That's Kathy.
Kathy, sorry.
I'll second Courtney.
All right, any other questions on that or discussion? Hearing none, all those in favor?
Aye.
Aye.
All right, opposed? Gary, you want to talk about the annual budget?
Sure. So I presented the annual budget at last month's meeting. You all have had approximately 30 days to review that. And I have not had any questions. However, as I discussed with you all, each of you, we did find an accounting equation formula error in the spreadsheet that was sent out to you originally. And I also have sent you the corresponding discussion that highlights the impact of that. Penny had put that together for me. And so what you are voting on will be the FY22 budget final sheet that was sent out, not the original sheet. And the difference there, as I explained, the original was around 8.5, and this one is that you have in front of you now is at 9.38. So that's really all I have. It doesn't, I don't believe it to impact the summary sheet that I had sent out originally. I will double check that, however, tomorrow, but I believe that covers everything.
Any questions for Gary? Gary, I looked at it and compared it to, our current budget and looked at where you were increasing or decreasing. And I thought it was very well thought out and planned for the next year so that we are prepared in case we need to continue as we have been with all of the COVID things and still being able to cover the services that we want to provide to our community. So.
Yeah, thank you. It's a team effort to put that together, so I can't take credit for that, but thank you.
All right, any discussion or questions? Then I need a motion to approve the fiscal year 2022 annual budget as presented.
Kathy, I will make that motion to present the annual 21-22 budget, 22 budget is presented.
22, yeah.
Not in a school year, we're in a budget year.
You're in the budget year.
Yeah.
Second, Gates.
All right, any questions or discussion? All those in favor?
Aye.
Aye.
Opposed? I need a motion then to continue the use of emergency reserves for COVID activities. I'm assuming you still want to do that, Gary?
Just to finish out the year, yes, but we'll need to have a different discussion in January. And what I just said will make more sense when I give my report because I've got some good news.
Okay.
When it gets to my report. So we put out looks like 151,000 so far of the emergency reserve fund. And again, when we started this thing out, that was projected to be significantly more than that. So Penny has done a really good job, and Daryl and Jason and everybody really, other staff members have done really good work finding other sources of money so that in fact, we are going to be at the end of December significantly lower in terms of what we anticipated the spending out of the emergency reserves than when we started out in January of this year. So good job, everyone.
Good job. Yes. All right. So I need a motion for the continuation of emergency reserves for COVID activities.
So moved.
This is Purdom, I'll second.
Any
And
other questions?
The motion was by Courtney, Kara.
Yeah, by Courtney, sorry.
All those in favor?
Aye.
Aye.
Opposed? Dr. Gates, the next thing is to motion to approve the updates to the school guidance. Do you want to make that motion?
Yes, I make a motion to delete the paragraph, the bulleted paragraph stated it is important to note that if either the person with COVID-19 or the person exposed to the positive case was not following the school's mask policy or was not wearing their mask appropriately during the time of exposure, close contacts should follow standard quarantine protocols and quarantine at home. That is all.
And so, Kara, you don't have to write every bit of that down. The main thing to capture is that Dr. Gates wants the bullet point at the top of page 12. He's recommending that be removed.
And we're also recommending that the remainder of the recommendation be accepted. Is that correct?
Correct. Well, that's that's up to Dr. Gates, but that was
Yes, I will also add that the remainder of the recommendations, as written, be accepted.
All right.
I'll second that. This is Purdom.
Dr. Purdom seconded that. So we have a motion and a second to approve the updates of the school guidance with the removal of the paragraph, the first paragraph at the top of page 12, but leaving everything else intact. Any questions, discussion? All those in favor?
Aye.
Aye.
Opposed? All right. Thank you. Daryl.
Okay, I'm gonna share my screen here, I believe. And while that's coming up, I just want to kind of do a quick survey. Kara, like we said, Kara is taking over some of the board activities, doing the minutes and everything. When she was pulling all of the minutes together and getting them out, do you all have a preference? Do you still want them physically mailed to you all, or is email an okay way to get them, or would you all still like both?
I prefer mail because the printing is quite a lot,
Okay.
but whatever anybody else wants.
We can definitely still go ahead and do those. What I think Carol will probably do in that case is go ahead and email them on the Thursday, just so they're out. And then if you want to review them kind of as they come in, and then we'll mail those out. We'll mail those out on Thursday too. Just sometimes with the size of the letters and sometimes the postal service, it's been a little bit slower, especially around this time of year. So we just wanted to kind of survey everybody. If you still need hard copies, that is absolutely fine. We just wanted to make sure it was as efficient as possible. So.
Well, are we still required? So I feel like it's kind of like you keep your IRS taxes. You got to keep all this stuff for 5 to 7 years, and it's hard to keep track of all that electronically at the moment.
Okay.
So that's why hard copy is kind of nice too. I usually keep them 5 to, what, isn't it 5 years that you try to keep this stuff, retain it?
We keep all of our board minutes indefinitely,
Yeah.
so they're for a lifetime.
Yeah.
You don't have to keep it, Kathy, because they do have that at the office.
Oh, so I don't have to keep it. I don't even have to retain my notes or anything?
Not unless you want to. I keep mine for a year in case I need to look back at something, but after that, then I don't.
Well, that's going to free up a little small shelf in my storeroom. Because I've been retaining for 5 years and just thinking like, well, it's kind of like you need to keep I've read that somewhere, you want to keep your notes in case something happens to where you can show that you've.
Well, Kathy, if it makes you feel any better, I've got 18 years worth of notes in my office, so.
That's taken a lot of shelving space up.
It is, yes, ma'am.
Daryl, I only need the emailed.
Okay.
I think, can we revisit this once we get back in person? Because if we are allowed to bring our laptops and have a Wi-Fi password at Clay County and be able to refer to things on email, that's just great.
No,
Especially-
absolutely.
Yeah.
Yeah, we'll just kind of
especially-
stand pat for now, and then
Okay.
we'll revisit that once we come back in person. That's a good idea.
Yeah, that'd be great. Thanks, Daryl.
Okay. Yeah, Kara is just an efficient person, and she's trying to be as efficient as possible. So she asked me this week, and so I wanted to bring it up. All right, so you have in front of you my report. It's kind of abbreviated this month. Just want to hit some highlights. There's a lot of similar stuff going on as past months, progress on all of it, but I just want to highlight a few things. So staff learning and development, we take staff learning and development very seriously. All of our trainings at the end of the year, we strive to have 100% of our staff take all of our trainings. It's a comprehensive list of trainings that Jamie and her team do a great job putting together. And we also take the public health core competency assessment once every year. And so that's just a good gauge. Those are our national core competencies, and there's a scoring system that you kind of do a self-assessment. And then your supervisor gets those results, and you get your results as well. But when we go to our performance evaluation and kind of crafting goals for the next year, we can look at those core competencies, those areas, and that may help the supervisor or the staff member identify a self-development area or a development area that the supervisor wants their team to develop on during the year. So they can put that as a learning goal for them for the next year. So that's on an individual level. And also with our education committee, they look at our scores overall and see where we're weaker at kind of our top three or our lowest three areas. And then they try to craft and form some training areas around that for our entire staff for the rest of the year, like during our Stag Day events. So just a lot of training and development going on right now. A lot of people are finishing them up. I just want to kind of keep you guys in the loop of what that looks like for us, but we do strive for 100% completion on all of our annual trainings, and I think we're very, very close on that.
I was going to say, are we going to make 100% this year?
I think so. I know that I know we've had, because I don't think we put the temporary staff in there as well. I would have to look back on that, but we've had a lot of disease case investigators and things like that. COVID has thrown us for a loop, definitely, but I think we're very, very close to getting all of our full-time staff that require it in on that. So Jamie put out a report to all managers last month, just so they can touch base with their employees and make sure we get it done by the end of the year. So another thing that we look at, we're always looking at data and how to improve our workforce. So one of the things that we've done in the past is work with the De Beaumont Foundation. So they partner with ASTO, and they do a work satisfaction survey. And so it's definitely from a third party. We've been working on getting more and more of our staff to sign up and take that, and we're going to get some good results for that. So we'll take those again on the human resource area. Jamie will take that, and then Kara will take help out on that, I believe, as well. We'll look at that data. We'll look at our org climate survey, which is listed in the other bullet point below it. And then we craft some performance improvement areas for us to focus on over the next year. Make sure we do, getting employee engagement and all of those things. So those are two. One is an external survey, one's an internal survey, but we use all of that information to roll that back into a plan to make sure our employees are satisfied. Let's see, going down through here. Like I said, there's a lot of stuff that is just continuing on, so didn't want to report out on a bunch of the same stuff. So on page 10, again, another survey, so a QI survey. A lot of the QI activities have been kind of shelved. More of the formal QI activities has been shelved because of COVID, but we did get an 84% response rate from our full-time employees on that. And we will definitely take into account that information. And as we start to reboot our quality improvement projects, the more formalized ones next year, we'll make sure that we're keeping up with the QI culture. We are still hiring for the continuous improvement specialist, so that spot is vacant right now. And Gary, are you going to talk about the FAB stuff?
Actually, I did not have that on my agenda to talk about.
Okay. This week we got some of our reaccreditation feedback back from FAB, and so we've got a little bit of work to do by the end of January. Multiple pages. We just got to sit down. We're scheduling a meeting for next week. To sit down and look at all their feedback. We're going to have some adjustments to do. Some are pretty easy to take care of. Others will take a little bit of work, or potentially finding another example. And so we expected that, but we'll get all those addressed and get that stuff submitted by the end of the year, or by the end of January. I apologize. Let's see. Environmental health. Just wanted to highlight that column there. So definitely still ahead of schedule in all of our inspections. All of those are up. We still got a month to go of reporting, but the majority of those are the ones that are supposed to be higher are higher. The ones that are supposed to be lower are lower. And so they're doing a great job in environmental health with that. Food inspections, again, we're ahead of schedule. I know we have a few staff out this month and throughout the rest of the month, but I think they're going to almost hit all of the scheduled inspections this year. COVID kind of had a hard time at the beginning of the year with us, but we caught up strong. Let's see. All right, what page is that? And down to page 16. Jason does a great job of kind of listing the number of clients that we serve in the COVID clinic. And I know these numbers are old now, but over 5,600 clients vaccinated at our clinics, and then another 7,800 through the Heart to Heart International clinics. We're still doing some homebound visits. There was only 4 of those this year, but we still have those partnerships going strong on that front. And all of our clinics, since we opened up, we have 45 appointments per day. Since we opened up the new age ranges, it's my understanding they're full every day still. So keeping up with the pace there. Our dental program is still getting out to schools, and so we hit 6 elementary schools and 3 private schools. Receiving the oral health screening and the first fluoride varnish application. So that is a definitely good to see that we can still get out into the schools, and Michaela and Carmen do a great job getting out to the schools and interacting with the kids and making them feel comfortable. One of the things that we're working on is the North Kansas City Early Education Center. That is the one, I think it's an old Hobby Lobby maybe, kind of in the Gladstone area. So we're working on a plan with them to get WIC services out there. So there's a really high potential of about 600 children could be in the enrollment pool in that. So we've got a whole lot of challenges to jump through on the application, but I can't remember on the conversation that I had with Jason today if it's good to go or if it's really, really promising. But the target, if everything goes through as planned, I think we could implement that in March. There's a little bit of a waiting period and an implementation period. So definitely would get our WIC numbers up in the community, and another great benefit for WIC families. And he told me that he had heard that those debit cards, before the state made a change, that you had to be in person to reload them, which caused some challenges when we were off-site. The state is now going to make the change where they can be remotely reloaded. So we'll still do the education, we'll still do all of those things, but at the times where we can load them remotely, we will once it gets implemented, because then those families won't have to take off work or try to find a ride to the health center to meet that appointment. It'll also let us be more efficient in our WIC program with our staff rolling that out. That's
exciting.
Yeah, definitely. And then Megan and Lori are also working with the Immune Extension with that center that I mentioned to do some cooking classes as well. So lots of collaborations going on. It's good to work with Immune Extension, good to work with our school districts, build those collaborations and also make a difference, especially to the kids that would be receiving the WIC services. So for STD clinic, we do have a vacancy there. I think I mentioned that maybe before. We're running a little bit of shortened hours, but I think we have a 1 or 2 promising candidates. I think one is going to shadow tomorrow, But I think we'll get that filled pretty quickly, get them back up to speed. But right now it's just a capacity issue. Jackie left, and then Pat is running the show over there. And we're also taking on, I think Jackson County's STD clinic is not accepting patients right now. So we're kind of hitting some of their folks that can come over as well. So that capacity will be back up and running like it has been very shortly if everything goes as planned. And I think that may be it. That is it. Is there any questions?
Thanks, Daryl. All right, Gary.
Okay, so as I said, I have some good news. The last night I attended the county commission meeting, and the county voted to distribute $655,015.55 of ARPA funds to Clay County Public Health Center to cover COVID expenses for the year 2021. And so, yeah, we're very grateful for that. That was part of our year one application form. I think I told you that when we submitted the original application, it was put into a business session and they had discussions, and then they said they would come back to it. That was back in October. And so what their intent is, and this also relates to the comments I meant earlier regarding the budget and the emergency reserves for COVID activities. So their intent, just to recap for everybody, the CARES Act distribution under the previous commission was an upfront distribution all at once. This commission is distributing money out of the ARPA funds. It is a measured approach where you incur the expenses, and then those expenses are then reimbursed if they're determined to be eligible to be reimbursed. So it's a different process. Frankly, I'm totally comfortable and fine with that because it shows just being good stewards of the tax dollars. And so I went to the meeting last night, and then they made that motion to do that. Then they asked me to come up, and so I thanked them for that. And then I also thanked them for and appreciated the measured approach that they're doing. And then I also informed them that we would be coming back for additional funding in 2022 rather soon, and probably in January. And I also asked if they would consider a more measured approach in terms of either monthly or quarterly instead of it being year end, because we will be operating out of our emergency reserves and don't want to go all the way through 2022 and then get the reimbursement for the entire year. I said if it's possible, I would appreciate consideration either on a monthly or quarterly basis. That allows us to plan. I told them last night I said I've got my board meeting tomorrow night and we have to adopt a 2022 budget. So if there's no ARPA funds in that budget, then we're going to have to operate out of emergency reserve, and then we will get reimbursed for that. So that's Dr. Purdom, to your point earlier. So they all nodded their heads in agreement, but that's still gotta go through the process. So so that's our intent, is we will go in January, and the year 2 of our budget plan that we've already submitted, we will then we will just take that back and shorten the time frame to either monthly or quarterly, and then we'll go that way. So That was really good news, and I'll be happy to answer any questions on the ARPA funds if you have any. Otherwise, I'll go on to my next item. Okay. On some personal news, I've been elected president of MOSIFI for 2022, and I've been elected vice president of MOHACA for 2022. So, and you know what? I didn't miss any meetings, and somehow that still happened. So, normally you miss a meeting and you come back to the next meeting and you magically have more responsibilities than when you were at the last meeting. But so I appreciate the vote of confidence from my peers across the state for both of those office positions. So I look forward to serving in that capacity in 2022. We got yesterday, MOSIFI did. I'm also on the legislative committee, in addition to being on the executive committee of MOSIFI. And our lobbyists provided us with our first legislative report going into the January legislative season, I guess we'll say. And there's already been 24 pre-filed bills impacting public health, some of them pretty negatively. So I'm going to send that report out to you tomorrow. As I've done in past years, whenever I get those reports, I always forward them to you, either as part of your Friday Facts weekly email or on a separate email. So I'll be doing that again this year. And speaking of that, I apologize for the less frequent Friday Facts and so forth here in the last couple of months. I've normally been pretty good about that, as you all know, on a weekly basis, but I've just kind of been occupied. So I apologize for that. But anyway, so I'll send that out to you tomorrow. There's some crazy stuff in there already, frankly, and we're expecting it to be potentially bloody for public health again in this upcoming legislative session. So we'll, more to come. We'll see. And then the last thing, well, not the last thing. One other thing I want to talk about is the COVID update. So I did want to point out that when we look at our numbers as of December 6th, and these numbers will get updated tomorrow, but for the entire Clay County, which is Kansas City and everywhere else, 67% of the population over 18 has initiated vaccination, and 63% has completed. And boosters have just only recently become available, but the figure for the booster third dose sits at 13%. So that's the overall numbers over 18. Now we've just recently had the kiddos be eligible, and so those numbers are lower. And so we expect those to climb, but that's the group that has been most recently been able to get vaccinated. And so those numbers are still low, they're catching up. But as you already heard in the report, those clinic, at least the health department, I think I mentioned last month, it's like the Rolling Stones are in town as soon as we open up a clinic. I mean, it's just booked. I mean, like that. So, and that continues to happen. So that's just for our clinics. But I had conversation, what is today? Thursday, Tuesday, with one pediatrician in her clinic, and they're just going gangbusters in terms of vaccinating their patients. And I know the other pediatric clinics in the Northland are doing the same. So it's just going to take a while for that group to catch up because they haven't had the long-term opportunity to get vaccinated. So
Gary.
Yo.
The
Yes.
Heart to Heart, I know Heart to Heart is not renewing their contract with you guys for their vaccine clinics in January. Do you think that is that something you guys are going to see an uptick in that because of that non-renewal, or do you think that's going to be a huge hole, or are you not concerned about that?
I wouldn't use the word huge, but we're having conversations about how we're going to process that, what we're going to do next. I think having just given you those vaccine numbers, I think we're probably getting close to the maximum percentage of people who are wanting their first and second doses. The big push is going to be, I think, in the upcoming months, getting those booster doses for those individuals that have already been vaccinated, and then, of course, as I mentioned, the kiddos. So, yeah, it's a bummer, Kathy, that we're not going to have that opportunity, because they've been a great partner. They've been going out into all the communities, to multiple places in communities, libraries, schools, I mean, you name it, and meeting people in their own community. So yeah, it's going to hurt, but because of what I just said prior to that, I'm not sure I would use the word huge, but it's going to hurt for sure.
Yeah. Okay. Just was wondering how the impact. Yeah. Thank you.
Yep. And so I'm going to share a screen now on the Data Hub, which was just updated. So can you all see the Data Hub now on the screen? Yes. Somebody give me a thumbs up.
Yes.
Got it. Thank you. Okay, so you can see here on Halloween, we were at 155, which was really a bottom out of that second wave, as you can see. And then after Halloween, boom, everything shot up. And then Thanksgiving, boom, we were at the number here on 11/28 was 571, which if you move your eyes to the left and follow the mouse, that's pretty much where we were at in January of 2021. So it was a significant, I mean, the rest of it was not even close, as you can see from the graphic. And so the numbers as of last week was down, but it was still 451, which you go eyes left, still the next closest one was again January 3rd of 2021. So and we've already talked, you'll see that's reflected in the hospitalizations and number of cases that the hospitals are seeing. As we talked earlier, North Kansas City Hospital yesterday, they had 109 patients, which I frankly don't remember them ever having that high of a number throughout the entire course of this pandemic. So, but that's kind of where we're at in terms of the cases. The Omicron variant has technically or officially not arrived in Kansas City. I don't know that. Let me just say, I think it's probably here. It just hasn't been genome sequenced yet to prove, but we expect that. We have an international airport, not in our county, but might as well be. It's only 15 miles from Liberty, 18 miles from Liberty, and so we expect that's going to happen. The current data information that I'm getting, and again, it changes as we've learned in this entire pandemic. Data information changes almost daily, but right now, the Omicron variant is believed to be much more contagious than the Delta variant, but much less lethal so far than the Delta variant. But that could, hey man, that could change tonight or tomorrow with the way this thing is going. So, but having said that, the predominant strain in our area through the sewer shed reports and then everything else that we have is still the Delta variant. So my personal
That changed really quickly.
yes. So trying to capture everything. I realize that everybody, including physicians and nurses and hospitals and the health department people and schools and just everybody in general is so sick of this pandemic. But still, my advice, for whatever it's worth, is that we still should be wearing masks regardless of vaccination status, and do everything we can to encourage as many people to get vaccinated, not only the first and second time, but also their booster. At some point, though, to be honest with you, we're going to have to live with this virus. We can't go on like this forever. I do think the Band-Aid is going to have to get pulled off at some point. And I have no clue or magical answers when that will be or how to predict it, but I'm guessing it's going to be sooner than later, because we're going to reach that, you've heard me say this for a long time, we're going to reach that saturation point when no more people are going to want to be vaccinated. We're certainly not going to mandate vaccine. So, at some point, we're going to hit that number, whatever that number is, and then there it is. That's your quote unquote new normal. So I think what will happen is clearly it's going to be endemic. If the technology continues to be the way it is, it'll most likely end up being possibly an annual shot, like the annual flu shot, quote unquote regular flu shot that we now have as a part of our culture. That's probably what's going to happen with this one. But that's, again, just my thoughts, not predictions, because I learned a long time ago not to predict anything in this pandemic. This has been crazy. So, believe it or not, and I don't want to leave you on a doggy downer, but in about 14 days, we will now be in year 3 of this pandemic. So that's an amazing thing to say out loud.
Yeah.
So that's all the things that I had to report on. I do want to remind you of your Board of Trustees self-evaluation. I've received a couple of those. I need to receive the rest of them. I'll collate all of that, those responses, and then that'll be on your January agenda for review and discussion.
Okay. Congratulations on your nominations for Mosifi and Mahaka.
Yeah, I guess.
So Gary, I did, when you were announcing those, it made me, I had the question, with Rex retiring and Faisal, of course, had a break in service when he came over to Kansas City for a little while. Where are you in the seniority of senators in the state?
Man, that's pretty harsh. That is really harsh, man. I'm actually in the metro. I am the oldest. Mary Jo retired this afternoon.
Oh, wow.
Yeah, I was at her reception this afternoon. So now that makes me the oldest health director in the KC metro area, in the Mark region. I don't want to say the Mark region, but let me say it this way: Kansas City, Johnson County, Wyandotte County, Leavenworth County, Clay County, Platte County, Jackson County, and Cass County. I'm the guy. Statewide, there's so many health departments, 115. I'm not sure where I rank, but I am definitely the oldest on the Mosifi ranks as well, with the exception of, I think, one person. Daryl, I think Stephanie might. I'm not sure how old she is. We're about the same age, I think.
Yeah, I
So,
think
yeah.
we're pretty close. Yeah.
Yeah. So yes, sir, I'm getting up there.
Well, I didn't want you to share your age, but I was thinking time in service. You're one of the most senior leaders in time of service in your role as well across the
Yeah.
state.
Yes, I think so. I think there's probably a handful of smaller health departments that have, in smaller health department, I don't want to belabor all this, but smaller health departments, normally the nurse is also the administrator. And I think there are a couple of health departments where there might be a nurse administrator that has me tied or beat. I'm not sure, but I'm not going to go out there and try to find that out.
Well, we're glad you're spending your time here.
Yeah, thank you.
All right, any questions for Gary? Gary, anything else?
Nope. Well, let me just say this. I know you're going to go into closed session, and I've already mentioned this, but I want to reiterate. When you go into closed session, go up to the upper right-hand corner, click on the leave box, and then click leave meeting and totally exit the open meeting. Then go to the link that was provided in the email to go and click on that for the closed meeting, and then follow the same procedure in the closed meeting when you leave, and then come back out, grab that email again and click on the open meeting link to go back in open session, because you do have to go back into open session and then adjourn the regular meeting and or any action that you would take. So and in the closed session, I would like Daryl to be in there for part of the discussion on the legal part, and then he can leave when you do the personnel part. And then what I will do is, well, we can talk about that in exec.
You want me to text you when we go back into open? So you can get back home?
Yeah, we can talk about that. Yeah. So that was it. I'm done.
All right. Does anyone have anything else right now for the meeting, the open meeting? All right, then I need a motion to go into closed session pursuant to section 610.021 parens 1 for legal action, and section 610.021 parens 3 for discussion of personal information about hiring, firing, disciplining, or promoting a particular employee.
So moved. Courtney?
Kathy, second.
All right, we have a roll call vote. Dr. Gates?
You're on mute.
Aye.
There
Aye.
you go. Dr. Purdom?
Aye.
Courtney?
Aye.
Kathy?
Aye.
And I'm an aye. All right, we are now in closed session, so if everyone will close out of this and come back in on the other link, please. Dr. Burham.
Hello.
Hey, Kathy. Hi, Dr. Gates.
Hi there.
I have to say, all of this trying to keep straight whether I'm in the federal year, the school year, or the regular calendar year reminds me of when I had got some immunization records once that were based on the Ethiopian calendar. I didn't know they even had their own calendar, so it's a little tricky to keep all this straight sometimes.
All right, Courtney. Yeah, Courtney, we don't see you. I don't see you, but
Here.
okay.
Oh,
There you go. There you are.
sorry.
All right, we're back in open session. Do we have to do a roll call to go back into open? I've forgotten.
Yes.
Yeah, I thought we did. All right, so we need a motion to go back into open session.
So
So-
moved.
This is part of my second.
All right, now we'll do a roll call to go back in. Courtney,
Hi.
Kathy,
Aye.
Dr. Gates,
Hi.
Dr. Purdom,
Aye.
and I'm an aye. All right, we are back in open session. Gary, we want to thank you for your service. You have done a wonderful, wonderful job under this very stressful time, let alone everything else, just the general running of the center. I would like to have a motion to provide Gary with a 5% increase for his services and for the great job that he has done.
So moved.
All right, that's Courtney.
I'll second.
Dr. Purdom has seconded it. Any comments or discussion? All those in favor?
Aye.
Aye.
Aye, everybody. All those, anyone opposed? All right, Gary, thank you very much. We truly appreciate what you have done and the way that you so very professionally stay on top of everything and keep everybody headed in the right direction and keep us informed with what's going on, and do an outstanding job, way above the expectations. I think you have been out there trying to think of everything before anything happens and trying to keep us at the forefront of what's going on, whether it's with this pandemic or whether it's with accreditation or just the quality of the services that we provide at the health department. And we really appreciate that. So we want to thank you. And Kathy will sign your addendum.
Okay.
So when you get that ready, if you'll let her know, she will sign that for you, so you can get everything into the files appropriately.
Well, I would like to thank the Board of Health for their leadership, their ongoing, unwavering support of the health department and its mission, and of me personally. It's an honor and a privilege to serve as the health director for the Clay County Public Health Center. And I am so grateful. My family and I are so grateful that you gave us this opportunity 18 years ago now. And just can't thank you all enough for that support. So you've been a great team. And y'all don't know it, but you've saved me thousands of dollars in counseling fees over the last year and a half to 2 years. It's been a pretty rough go, but hey, it's been a rough go for everybody. So, but again, thank you for your support. It's means the world to me. Thank you.
You're welcome. And I hope everyone has a Merry Christmas and a very safe and blessed New Year's. And
Ditto.
we'll come back in January and start a new year.
Yeah, that's crazy to say that, isn't it? Man.
All right.
Merry
So
Christmas.
I need a motion for dismissal at 7:53.
So moved.
All right. Who-
Courtney
which
moved,
one got it?
Kathy second.
Kathy?
How's that?
Okay.
All those in
Courtney?
favor?
Aye.
Aye.
Opposed?
Seconded
Anybody?
Courtney, correct?
Courtney made the motion, Kathy seconded.
Oh, okay. Very good. All right. All right.
Thanks,
Thank you,
Gary.
everyone.
All
Thank
right.
you.
Bye.
Have a
Merry
good
Christmas.
Christmas.
Merry Christmas.
Merry
You
Christmas.
too. Merry
Bye.
Christmas.
Bye.
Bye.